Thank you so much. It's really not fair, right? I've worked so hard to come here, and we're here, and we're being told we're at a higher risk. No need to despair. It's also a very challenging topic to talk about healthy eating in the middle of lunch. I usually don't talk about diabetes in the Christmas season, too, with my patients. So this is really difficult, how to get into behavioral changes with our patients. Kamusta po? I hope everybody's doing well today. And I'm a physician at Kaiser Permanente. I've been with a medical group for almost 25 years now. And I'm very excited to be here and being part of this panel. For the very first time, for many of you, this is a milestone. Never been put together, with many prestigious healthcare organizations coming together to talk about health of the Filipino patient and our Filipino American patients in particular. So it's really an honor to be here. I'd like to thank the Philippine Consulate and Rudy and our panelists. So I'll introduce to you the Kaiser Permanente program, and many of you may not know, we are designated a Center of Excellence for Filipino Health, putting together a series. It's a 7-part program that touches on every aspect of Filipino health for our patients. And the Filipino American Care Experience, as you can see, has 7 parts to it. We've put together translated Filipino health education materials. We have health education classes for our Filipino patients in diabetes, heart health, and life care planning. We have put together work for our non-Filipino physicians and staff who are dealing with Filipino patients, and how to communicate with them in a more culturally competent way and being respectful and sensitive of the Filipino culture. We've also been out in the community, partnering with many healthcare organizations as well as community organizations, particularly Pistahan. For many of you who are out there in Yerba Buena, every year we have a health booth, and we are actually the major health sponsor for the annual Pistahan event in San Francisco, Yerba Buena Gardens. So we bring our physicians out to the community. We're also very sensitive to the needs of the Filipino American patient, and we're instructing our staff, our medical assistants, our nurses to capture the demographic population indicating Filipino in our medical records. So whoever touches that patient will truly be connecting with them in a very culturally respectful and sensitive manner. So that in a nutshell is our program. I'm going to talk a little bit about our diabetes classes and the learnings we have found out in our Filipino American patients. And hopefully it's not such a sad state of affair when you think about being in the U.S. brings us at a disadvantage compared to the other, to our fellow Filipinos in the Philippines. So diabetes, and I don't want to belabor the fact, because Amy went through that. The facts are 1 in 5 adult Asian Americans have diabetes is Filipino. So think about that, 1 in 5. So if you count 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1 is a diabetic. 1 in 4 Filipinos have high cholesterol, and 1 in 4 Filipinos have high blood pressure. Okay? So the good news is there's things we can do, and that comes with education. And education is a really big deal. Understanding, increased awareness, how to manage your diseases will prevent us from having complications. So I want to ask that. Do you or anyone you know has diabetes? Just a raise of hand. I know this is confidential. There you go. Okay? If not here in the Philippines, correct? Okay, that makes it even more important. Why is it important to control diabetes? It's because of the complications of diabetes. Okay? Anong nagagawa ng diabetes sa katawan po natin? It affects the brain, the eyes, the mouth. Alam niyo lahat ang stroke, blindness, diabetic retinopathy, heart attacks, correct? It affects our kidneys, leading to kidney failure. Many of you know or know of somebody or relatives who are on dialysis. It affects our hands, our feet, leading to amputation, poor circulation, risk of infection. So this is the main reason why control of diabetes and sugar is really important, and to prevent the complications. And how do we do this? This is key. The first two is for our diabetic patients: medication management and self-monitoring. Here's where all of these barriers come into play, because many of them are not really good with self-monitoring, not checking your blood sugars. It's masakit magtusok ng karayom. It's really painful to check your sugars every day. That's another barrier. It's also denial on your medication. For some of them, thinking that they need to be on insulin is a death sentence. It's really not. It's a reason why you will live longer if you're on insulin. And for everybody, for all of us who are not diabetic, it's important to do the other things: physical activity, healthy eating, and of course managing stress and emotions. Okay? Believe it or not, stress really affects sugar control. And for some of us who are immigrants working really hard, 2 jobs for some of our patients, stress is a really important factor in controlling diabetes and their sugar. So I'd like to talk to you about the learnings we've had in our diabetes classes in South San Francisco. So Filipino Diabetes Self-Care Management Program was put together at South San Francisco, Kaiser Permanente, because we do have the largest population of the Filipinos, largest concentration of Filipinos outside of the Philippines. I've been told over and over that, Daly City and South City. And I see them in my practice. Most of my patients are Filipino children. So the goal is to improve A1C control in Filipino members with diabetes. And for some of you, A1C control is what we follow for physicians. It's sugar control for the last 3 months. So they come in, get a blood test, they see their physician, and we have them track their blood sugars through their A1C. It is a 2-hour class, and the goal is modifying traditional Filipino diet. Really, not changing what you eat, but substituting healthy dishes, your traditional Filipino dishes, and making them heart healthy, less salt, less fat, less carbohydrates, not too much rice. That hurts a lot for some. It's really drastic change, especially kanin, right? We're big rice eaters, and yeah, we're telling them don't eat too much rice and counting carbohydrates, which is instead of 10 taso ng kanin, isa na lang kaya. Or a big plate full of rice, you want to manage your plate a little healthier. And incorporating activities that works for the Filipino patient, not just saying you're exercising or going to the gym, because we don't really do that, right? I mean, how do you incorporate physical activity in what really is meaningful for our Filipino patients and to help improve their blood sugar? So we tracked our patients, and we really saw good outcomes. We see their A1C control, that means their blood sugar control dropped by at least 10 to almost 50% for some of our patients. So when we followed our Filipino patients and having them attend this class, it's a Filipino class taught by a Tagalog-speaking nurse, and really digging into what they eat on a daily basis, how they move, and checking their sugars and being adherent to their medications, their sugars drop. And we see really good control. Attendance of a class with health education showed control of their sugars, leading to better diabetes control. But it only lasts 3 to 6 months at the most. And you could see this tracking through our classes that, yes, they're really excited about the attendance of the class. They walk away from the class saying, oh, I'm going to really make a change. And their sugars come out better, but it only lasts 3 to 6 months. So we had to step back and think somehow, how do we do phase 2 of our research, of our program? Because what we have is not a A1C control. When we tell them to take their medicine and do healthy eating and change behaviors, they do it. But they're not adherent to their medication. It only lasts 3 to 6 months. And so what we have is not a sugar control problem. It is a medication adherence problem. They stop taking their medicine. They stop doing the healthy behavior. They stop eating the vegetable. They get tired. Kakasawa po doktora, you know. And I'm tired. I have no time. You know, what else is there to do? Especially the Filipino beliefs, you know, it's like, all right, mamamatay din lang tayo. Why do we have to work so hard? When, you know, it's so hard. So it is not it's not a sugar control problem. It is a medication adherence problem. And we needed to find out what else is there that we can do for interventions to continue to keep them motivated long term. Okay? This is a chronic condition. It's there. It can be controlled and prevent the complications. So our goal with our second phase is to improve long-term A1C control in our Filipino members with diabetes. And so we set about doing these different kinds of things. Where's my person is gone.
Because I think he's setting up the...
Hold on, they're getting the sound on the streaming because a lot of people are in YouTube and they cannot.
They cannot hear.
So should we wait?
They cannot hear the symposium at all, but they see the stream.
Information. Okay, technical difficulties. Are they not hearing? They're not hearing. Oh, they're not hearing.
Ayusin ko na rin yung mic. Pasensya na po kayo. Lalagay ko lang dito. Sapit ko na. Nawala po kasi yung clip eh. Ipapatong ko na lang po dito. Para hindi po kayo maabala. Pasensya na. Oo nga eh. Kaso nawala po yung clip namin. Nahulog ata sa sasakyan. Thank you, Doc, ha. Pasensya na po kayo.
Can they hear this? Okay. Can I just say a few things? Bear with us for a minute because we're live streaming this, and there are people watching this thing all over the world. And so we want to make sure that we are getting the message out and so that they're hearing us loud and clear. So bear with us for a few minutes while we make sure that our program is being heard all over. Incidentally, all the senators in the Philippines were given the access to our live streaming, and we're hoping that they're also announcing it to everybody in the Philippines, so that they will know that what we're doing here. Thank you very much. Oh, by the way, hold your questions because at the end we're going to be passing out some of these pieces of paper so you can write any of the questions that you have. And also, if you have any questions to any of the panelists, if you get a program, their bios and their email addresses are there in the program. Thank you. Dr. Siko's husband got a lot of phone calls because a lot of Dr. Siko's things are...
They cannot hear you in the live streaming. But that's okay. They're all excited. That's why they call it. Okay. Hold off. Hold off. Only the last few minutes. Good to hear. Yeah, it was doing fine except there was a blitz. It could be the Wi-Fi.
It could be their Wi-Fi. It's working. It's working. It could be their wireless connection. Their wireless.
Well,
their
it's good that they call in.
Yeah.
Let's go on.
Okay.
Because I hear it. I just heard it on mine.
So we
I'll have
decided
to turn
for
up
the
the
sake
volume
of time
manually, so this will be made into a YouTube video that you can access, and I'll just
at
turn
the
it
end,
up with
but
computer
we're
software.
passing the thing for them to write and we'll connect it.
Okay, so I think we're gonna go. It's fine. I think it's their connection. Okay, for the sake of time, let's hold questions till the end, and we're gonna pass out little pieces of paper for you to write down your questions, and we'll address them at that point.
ahead, next slide. Okay, thank you so much for staying through the talk. I was just getting into the good parts.
It was your husband.
Yes, okay. So, like I was saying, so we had to find out and step back, what is it that we can do better for long-term control of A1C for our diabetic patients? This is where the question came in. So we have to understand what are the barriers to care, okay? And I'm answering some questions in the back as I talk about this one. So barriers to care, the belief system barriers. This is now where you address the bahala na attitude, okay? Fatalism. They attribute their disease to a higher power. It's like as if I was born, I will have diabetes, my father passed away with diabetes, my grandparents are diabetic, everyone in my family is diabetic, I'm just gonna die and be diabetic. So it's attributing to a higher power and not taking it on themselves. The other is selflessness. You know, my patients and most of us here are caregivers. We either take care of our family, which we do. We have our regular jobs. We come home, we still have to take care of our family. Or we work as caregivers. Okay? So patients really tell me, I have 2 to 3 jobs. I have 2 jobs. Self-care is not a priority. They claim they don't have time to cook healthy dishes. They don't have time for physical activity. They don't have time for anything else for themselves except for others. So this is a common theme I see in my patients. And there was one case of a man, I'm going to share you an example, a 50-year-old man who was diagnosed with diabetes, and he was deemed non-compliant. His physician said, you really are non-compliant with your medication. We're not going anywhere. He was hospitalized several times. He's on dialysis. He went to the emergency room at least 5 times last year because of uncontrolled diabetes. Upon asking him further, he said that, well, I have 2 jobs and I'm sending money to the Philippines to support my niece to buy medicine because she herself has diabetes. So you see all of that selflessness. And so what we told that man, the patient, is if you think about being a role model for your family and that you have to live long so that you can care for your family, it changes the philosophy a little bit for him to think about, yes, if I'm not around, then everything else falls apart, and how to care for himself first too. Okay? Medical system barriers. So we had to address language, and yes, we speak English. Majority of our patients speak English, communicating with them through their appropriate translated materials. And all our health education materials are translated into Tagalog. We have bilingual health educators. Our nurses, our dear Filipino nurses, are all over our hospital system, and so they're able to communicate with our patients. We've also worked with our non-Filipino physician colleagues to teach them how to communicate appropriately to our Filipino patients. Limited culturally appropriate resources, we had to address that. All of our materials are matched culturally with the food they eat, carbohydrate counting, calorie counting, with things that they deal with on a daily basis. And teaching our physicians that the approach to our Filipino patient is different. The Western way of medicine here is geared towards more of an individualistic approach. We had to teach them that no, individualistic approach doesn't work for our Filipino patients. You have to include the family. There's always a significant adult daughter or son who comes with the patient who is involved in care of mom or dad or grandmother or grandfather. So it is a family activity, and decisions in healthcare are made as a family. So our essential elements are the culturally tailored education, meal planning, and carbohydrate counting in Filipino. We put together a support group, and this is a group of Filipino patients meeting together after they attend a class to have more time in discussion about issues, about what works for them and what doesn't work for them. It fosters a sense of community amongst our patients. It also holds them accountable and they share phone numbers, and they go out and Zumba dancing or walking in Siramonte Mall after as a physical activity. It makes it more fun for them. It really helps them continue to remain motivated. And technology and cultural fit. We have to put this as part of our pilot because we know that Filipinos in the US with smartphones and Android, or even in the Philippines, I was told they're the highest text messenger using in the world. So we had to adapt our program to fit. What is the cultural fit for our Filipino patients? So we ended up with 4 different kinds of interventions for our patients. Some are very comfortable with secure messaging, that's email your doctor, which is a feature for Kaiser Permanente. Some are very comfortable with telephone appointment visits, so they would have telephone appointment visits with a healthcare team. And some are really good with video visits. They would much rather video in to their physician. And this is really a neat feature for some who prefer an in-person encounter without actually being in the office and making a trip to our medical center. And of course, some prefer to see their physician in person. And you could see, of course they like incentives. So we created a reward system for our Filipino patients to get a few stars in their card when they come in and continue to remain motivated. Our reward system has ranged from raffles, like a little bingo game we do with them, or we do, they get to win pedometers, exercise bands, cutting boards, chopping boards, and shopping bags. So you have a lot of incentives for our patients to continue to keep them motivated. The other things that work for them are culturally relevant materials, as I said. You gotta appeal to what is meaningful for them, what they eat, physical activity that works for them, the stress management. We also have to change the way physicians talk to their patients and make it more of a prescriptive, direct approach to their patient instead of giving them too many choices that patients get confused. So this is a learning mode for our physicians because our Filipino patients would say, well, doc, you're the doctors, tell me what to do. The Western way of medicine, the way we are taught in the US medical system is patients have a choice. Too many choices, though, kind of confuses the Filipino patient. Yes, there's some who were making a choice works, but some really just want to learn how to do it better. The next learning would be, sounds technical things going on. Physician leader team approach. So having the physician be directing the care and working with the healthcare team, the physician introduces the team, the physician tells the patient that my team will be calling you, the team talks about that the physician will check on your lab work, will check on your visits, and in the end, if the patient does not show for appointments, we have the physician calling the patient if they don't show up for appointments on the 3rd time. And I don't know where else that happens because we have them on a list and the physician, their personal physician calls them and asks them, why aren't you showing up for your appointment? Next. And then teach back opportunity. Again, this is a learning issue for our physicians. We ask patients, what is your homework for next week? Okay, it allows them to talk back and give us an idea of their understanding of the instructions, and asking them about their homework for the next week needs to be very behavior specific. So what we're asking patients is not to just say I'm eating healthy or I'm exercising. Very behavior specific commitment to change means, oh, I'm going to drink more water. It may sound simple, but hydration is really important for diabetics. And it helps control their sugar, but giving a statement like drinking more water is a really key significant step as a commitment to change. Or I'm going to exercise, exactly what are you going to do? 30 minutes at Siramonte Mall at 4 o'clock. And all of these little details are logged into the patient's medical records so that their physician could see exactly commitment to behavior change, which is really key. A small step at a time goes a long way to controlling diabetes. And I'm going to show you the lumpia. It's very Kaiser healthy lumpia. And this is a metaphor for what the Kaiser Permanente integrated healthcare system is. And the analogy is that the physician, the personal physician, is the wrapper that holds it together, and the ingredients are the healthcare team, the diabetes healthcare team. So every interaction with the patient is asked, have you controlled your sugar? Are you doing anything to keep healthy? What is your sugar today? And if the patient is not doing well with self-care, then he or she is linked with the diabetes team. And the diabetes team consists of many people. I'm going to show you the diabetes team. We have a health coach, behavioral health, clinical health educators, registered dietitian, our chronic care managers. We also have a pharmacist. We have a specific diabetic nurse. And that flows up to leadership. The chief of medicine is involved, the module leader is involved, the primary care leadership group is involved, and we have a diabetes physician champion. And they download a list of our diabetic patients, and that goes in front of a physician's desk every month to make sure his or her patients are taken care of. And primary care physicians are the wrapper that holds it together. We have worked with the American Heart Association to create heart healthy recipes, understanding that you cannot stop them from eating traditional recipes that we know and grew up with and really appeals to our soul. So we've created recipes, and I've shared some in the back for you. And we've taken these recipes and made them heart healthy, substituted them with less fat, less oil, less carbs, but keeping the traditional flavor of the recipes that you love and know since you were a child. So not to despair, I want us to look at this as a tool for the future moving forward. Health education is the key. Kaalaman ay kayamanan na hindi maaaring nakawin. Knowledge is really important. Knowledge is wealth that cannot be stolen. We impart this to our patients, we impart this to you, and hopefully you can take some back to your area and create some programs that commit to changes in health, behavior, medication management, and healthy behaviors leading to better health outcomes for our patients. We cannot start over, but we can begin now and make a new ending. One more. I will be sharing with you a video later on Healthy Filipino Celebration. It's a locally produced video with our Kaiser Permanente physicians, but it's too tempting to show it because it's through lunchtime, and so we're going to show it later.
Great, thank you, Dr. Seco. Again, unless there's any burning questions, we're going to try to save it for Rudy.
Yeah. We have a supervisor of the San Francisco who is basically putting out legislation to prevent our kids from becoming obese. And I'd like to, if I may, I'd like to ask Supervisor Scott Wiener to say a few words about the legislation that you're putting together now, so that it can help our kids learn about how to prevent from being obese. Ladies and gentlemen, put your hands together and welcome Supervisor Wiener.
Thank you. Hi everyone, how are you? Good, good. Thank you for being here today and for caring about the health of our community. I'm Scott Wiener. I have the honor of serving on the San Francisco Board of Supervisors. And we're working very hard to try to address what I really think is this tidal wave that has been and continues to come toward our community, not just obesity, but type 2 diabetes, where it's a little bit like the drought, where people, they sort of know there's this problem out there that we're not really fully dealing with, but people don't always appreciate just how monumental it is. And we are moving towards 40% of Americans having type 2 diabetes. If you just imagine what that means for our healthcare system. And whereas it used to be that type 2 diabetes was for, we associated it with as you get older and sort of a disease of aging, we're now seeing more and more young people, including students in the San Francisco Unified School District who have type 2 diabetes, and more teens are pre-diabetic, and it really is a huge healthcare challenge. And in communities of color, it is even more extreme. We're heading towards 1 out of 2 people of color in this country having type 2 diabetes, and I know it is a significant problem in the Filipino American community, and so having information like we're sharing today is so important. And so there are many causes of obesity and type 2 diabetes, but one of the most significant culprits are sugary beverages. We know that one 12-ounce can of soda has 10 teaspoons of sugar in it. These sugary drinks are the top source of sugar in our diet, and the way that liquid sugar is absorbed is much different and much worse than even sugar in candy or in food. And so when people are over-consuming huge amounts of sugar in liquid form, it floods your liver, it leads to fatty liver disease and also to type 2 diabetes. And so last fall, we went to the ballot with a soda tax to say we should be treating soda like cigarettes. If you want to buy a pack of cigarettes, you're going to pay a tax, it's going to be more expensive, and so people will make healthier choices. And so applying the same theory to these sugary drinks, we went to the ballot, and the soda industry, like the tobacco industry, they have a lot of money and they're not scared of spending it. And they came at us with $10 million from Coke and Pepsi and Snapple and Dr. Pepper and the rest of them. We only had $300,000 from the dentists and the doctors and the hospitals, all the health groups that were helping us. $10 million, and 56% of San Franciscans voted yes, even though $10 million were spent against it. We needed 2/3, so we didn't get it. But San Francisco sent a very loud message about what this city is about, which is about public health. Berkeley passed it. And we're going to, at some point in the next year or two, go back again and try again. But for now, at the Board of Supervisors, we have several pieces of legislation, including one that would require that advertising for sugary drinks have a health warning on it, like with cigarettes, saying that these drinks raise your risk of diabetes and obesity and tooth decay. And we have some other legislation as well. And we're trying to educate people first and foremost to understand that drinking a can or 2 of soda a day increases your risk of diabetes by 26%, to make sure for themselves and for their kids people understand. And so it's important that we all spread the word, and look forward to working with people on that. So thank you for having me today, and thank you for organizing this. This is incredibly important. Thank you.
Well, thank you. That was unexpected, but thank you. You know, I think that emphasizes that beyond, you know, acting at the individual level, we can do a lot to mobilize community and advocate for reforming the environment that contributes to the chronic disease burden in our community. Okay, so thank you, Dr. Seco, for that really enlightening and informative talk on what Kaiser's doing to address the epidemic in our community. Now we're going to hear from Dr. Gabiola. Dr. Julieta Gabiola, she's a clinical associate professor of medicine and educators for care at faculty at Stanford University. And she's going to talk a little bit more about address head-on the cultural issues among our community that might influence some of this disease risk that we're dealing with, as well as clustering of risk factors of disease. Thank you.
Hi, I'm Julieta.